Hello, everyone, and welcome to episode 44 of Divergent Dialogues. Today we have a special guest, Vera. Welcome, Vera.
Hi.
So Vera, they is a senior clinical psychologist and board-approved supervisor based in Sydney, Australia. They work with adults who are survivors of trauma, supporting them through the healing process with a person-centered, culturally sensitive, and neuro-affirming approach. Drawing on trauma-informed modalities such as internal family systems, EMDR, and somatic practices, Vera helps clients reconnect with their inner wisdom and sense of self. As a late identified neurodivergent person with lived experience of high masking, Vera values authenticity and understands the challenges of living at the intersection of multiple identities. Through both their clinical work and personal growth journey, they aim to increase the awareness of trauma healing and the importance of doing the work to live a fulfilling life. Awesome. So yeah, I'm super excited for this episode because Tina, Vera, and I will be attending the Neurodivergent Minds conference, which is next week. I've been looking forward to this for so long.
Yeah,
I can't wait.
here.
It's going to be so cool. So Vera will actually be on the panel Living on Your Own Terms, Neurodivergent Perspectives on Daily Life and Support. So yeah, how are you feeling about that?
Yeah, I'm pretty excited actually. Yeah, full disclosure, my first panel, first presentation at a conference, so there'll be there'll be a lot of new things, but it's nice to be like among, friends and just like a, supportive community that yeah, neurodivergent people, and I think also just very uniquely like being able to just talk about me and, you know, hopefully that
Yeah.
bring some value, but like yeah, like it's something that you can't really like prepare for because it's like I just gotta show up as me and talk about me. Yeah. And how I do life basically.
Yeah, definitely. Yeah.
Mm.
Yeah, not being able to prepare that, yeah, that does kind of make things a bit uncertain.
Yeah, I mean, to be fair, like we've got some questions already sort of set up, so there's some bullet points to kind of think about, but
Oh, that's helpful. Yeah.
yeah, but just kind of like, it's a little bit different from, here's the research and this is what the research says. Like,
And also, like a neurodivergent panel, like usually there's a few ADHDers. You don't like the plan changes like within the mobile, but a kind of volley
Yeah,
that go. But I
I would
think,
get, my ADHD would
yeah,
probably kind of like that, but yeah, I just don't want to be the one that, like sort of be the one rambling away, but I'm sure we'll manage that.
yeah, like just kind of like bounce off each other.
Yeah.
Oh, anyway, so I guess yeah, this is a little bit of taster for people to learn a little bit about you.
Mhm.
So yeah, so I'm really curious. Like, can you tell me a little bit about your own late diagnosis journey? Like, when did it start?
Yeah. So, hasn't been too long ago actually. I think it was around like mid to late 2023 that so the first aspect was the ADHD that I was questioning. I was seeing a therapist for a couple of years at that time, unpacking a lot of stuff around like my family of origin and back then, I guess thinking about like anxiety and that being a big part of my daily experience was something that was like very pertinent and like a lot of my therapy was kind of revolving around that, but there were some aspects of that that just didn't feel like it was fully fitting, like it wasn't answering like a lot of things that I was experiencing. So that's where the whole like deep dive go down rabbit holes like kind of happened. It was also around the same time that my the clinic that I work at, the private practice that I work at, was kind of taking on ADHD assessments. So I had quite a number of clients that were coming in requesting for assessments, but also like just questioning ADHD. And so there were like kind of this, two parts of me that were like, this sounds like me, but surely that's normal because like surely everyone like struggles with like organizing and procrastinating and avoiding tasks that are boring. So it really like challenged my, worldview about things and myself. So that's kind of how it started. And it's a whole process as well because I did go through that experience of, my first psychiatrist again telling me that, oh, this is anxiety. It's not ADHD. And but fortunately kind of then things started to kind of, form much more clearly. Then that's where the autism was also kind of like coming into play. I got myself assessed in early 2024. So that's where I had my diagnosis of ADHD and autism. And then I did another sort of separate, giftedness assessment as well. And then that sort of also came about. So got all three of that. I should also mention that my psychologist who assessed me for ADHD and autism also identified PDA for me. So that was also something that I was like, oh, like, I mean, I kind of knew about PDA by that point, but didn't think that was me. I think that was also part of the experience that I had to kind of come to terms with, that a lot of times how I cope with things in the past was to minimize and downplay what I experienced. So it's like, oh, like I kind of relate to that, but it's not that bad. It's not, it can't be that, yeah, but that's changed now. So so here I am, like, I guess, how long has it been now? 2-ish years. Very much like, accepting of my identity, and it's I can kind of see how that is just me, and I think we might sort of touch on some of that a little bit later, but it's been such a journey as well, and sort of like how I relate to myself and my neurodivergent identity and traits has kind of really shifted over time. And kind of like even seeing a lot of them, like, not just like sort of like neutral, but also in like a positive light as well. Yeah.
Yeah. Yeah, definitely. And I think like I can certainly relate to that experience of, I guess, having my personal journey, but also working with neurodivergent people and seeing these connections. And, as much as, well, I hope my clients have learnt a lot working with me, like it's been like a two-way street where I've learnt a lot through, them sharing their experiences. And I think a lot of like neurodivergent folks, I guess, because there's not a lot of representation for us necessarily, or like authentic representation, we have to kind of like resonate and bounce off each other to try and like figure out what's going on. Or do you kind of experience this? Or like, is this just like a usual thing for everybody? Or is this a neurodivergent thing? And, I think that's why, I think like particularly autistic culture, but like a lot of neurodivergent culture, like it's so rich in like concepts and words and all this sort of stuff, because like we've just had to be creative and come up with our own labels, because we couldn't like rely on the medical model to, I guess like authentically capture the experience.
Definitely. Yeah.
Yeah, it does get really confusing, I think. When you do, especially like from that professional perspective, like reading it in diagnostic, like, and the way it's nicely packaged in the DSM. But then, and I think having those experiences of constantly being dismissed for what we're actually dealing with, I find that I will naturally default to minimizing, justifying, and rationalizing why what I'm experiencing isn't actually what is being described in the DSM. The words don't really fit properly, because like Caitlin said, it's what we experience is a bit different, but I think that the gendered nature of the DSM and then our experiences, it just makes it way too easy for us to minimize what we're dealing with.
Yeah, there's a really good point around like gender, and I know that's something like that is so pertinent to now female presenting people being diagnosed much more. Also, like a couple of things around like the DSM. I mean, as a clinical psychologist, like that was a thing that was drilled in my training, but it wasn't helpful because I wasn't also picking up like the right I guess aspects of someone's autism or ADHD. But I was thinking about how, like for my experience around being highly masked, and not even knowing that I was masking, because I thought that's just like, how you should human, right? And that in itself also does impact on how someone presents and what gets picked up. So clearly that was the reason why no one picked up my ADHD and autism and all of that. And ironically, I have a younger brother who's only 2 years younger, and he was identified like since childhood. So that was my that was the rhetoric I was given, that is what ADHD and autism is. Even at that time, it was like you can't be diagnosed with both as well. It's only, I think, around 2013 or 14 that you could have both diagnoses. So he was also going through that whole like, it could be this, could be that. Turns out it's both. But what was my experience was then, I guess being told that, oh, you can't be because this is what it looks like, the more externalizing and I guess like high support needs, like kind of like presentation of that. And one other thing was also about, like the DSM is, I mean, if anything, it is a medical model, does kind of have some psychosocial aspects now as well, that, the DSM-5. So it's good that they kind of have identified and actually mentioned about like masking and different presentations, but it's still very much looking at, say, for autism and even ADHD, like someone who is actually struggling and in burnout, so it's kind of like you still need to have that level of like functional difficulty in order to be identified. And, we do know like the neurodivergent experience. So let's say even like with autism, it's not just about, like difficulties in social communication and stuff like that. It's also like autistic joy in being like really, deep in one's interest. And, the DSM unfortunately doesn't cover that. And it makes sense in terms of like, diagnosis and, in terms of like where we get people in terms of like support and treatment and whatnot. But then that also clouds the judgment of how we look at neurodivergence. And so I think that's kind of where, like, especially I think like in my journey as well, and kind of like going like, oh, actually, like the way I experience these like, intense feelings about things and sometimes like this deep joy and interest and like excitement, like I don't think that if I go to a professional who, is kind of looking purely from that lens, it's not gonna tell me that that's my neurodivergence. They'll say you're fine,
Yeah, I like to say that the DSM, like, we don't diagnose happiness. So to reach the diagnostic threshold for a diagnosis, it's essentially about that impairment. And but yeah, like you said, what if I am autistic, ADHD, but I don't have that that significant level of impairment, but whatever reasons, different families provide different sort of scaffolding and whatnot, but yet it's still really helpful to know that I am ADHD or I am autistic, but I've been told I'm not, because it is all about that diagnostic criteria. So yeah, I find it a real tension between how helpful it is to have the diagnosis, or what can be termed that label, because it adds a really nice way to understand yourself. But yeah, to I guess achieve that or be to have that, it is about impairment and the diagnostic criteria.
Yeah, well, I think that's a good segue to, I guess my next question, because I think, when, as you were saying, like Tina and Vera, that when, like it's like you have to demonstrate a certain level of functional impairment to meet criteria. But when people who perhaps either due to masking or, maybe for them, they've found their kind of ways to accommodate themselves, at the end of the day, like there's still a neurotype difference. And when we don't have that label, unfortunately, sometimes we attribute some of those challenges to voice or personality. So essentially, it's like blocking people from like self-understanding. Yeah, so I think, and I guess I can speak for myself and for a lot of my clients, that that results in a lot of experiences of trauma and detachment from self. So yeah, I know, like Vera, like trauma work is something that's really big in your practice. So I'm just curious, how did you get into trauma work originally? Like, was it through, is it something you always wanted to do, or is it something that naturally kind of progressed over time working with your clients?
Yeah, I would say, I mean, now that I know in hindsight, like, trauma work was probably a special interest. But when I did my postgrad training, trauma really wasn't covered that much. I think these days they have a bit more, I guess. Yeah, they do kind of teach that a little bit more and weave that into other curriculums. But at that time, when I did my training, it was just one class on PTSD. And yeah, like, that was that was it. And but I did remember that I was really more interested in the types of therapies and ways of thinking that would go beyond like kind of, here's a problem, here's a symptom, let's kind of, fix it. It was kind of like, why is this happening? Why is someone experiencing this? Like two people with, what looks like, I guess, anxious symptoms or depressed symptoms, don't kind of come to that from the same place. Like they could have such a variety of experiences. And why is it that some people, are able to, I guess, feel better after like just, a couple of sessions? And, like kind of, if we go with like the typical, structured CBT approach, cognitive behavioral therapy, it can work for some people, but there are a lot of people where it actually is not helpful sometimes. Yeah, in fact, could make things worse if it's not actually kind of, I guess, person-centered or meeting their needs. And so I guess for me, it started off with, I wasn't thinking about trauma at first, but it was just kind of the idea of like, things to do with like family of origin or like early life experiences, childhood experiences. And so as it evolved, I think it was towards like the later part of my second year in training, I was like, okay, trauma is like the thing that like I'm gonna kind of, learn more about. So I then, when I started as a registrar, so after we finish our postgrad, we have 2 years as a registrar. I was seeking like supervision in like trauma work, did a lot of trainings in it, and so again, like thanks to my, neurodivergence, like, because I was really interested, I was like absorbing lots of information like a sponge, which like did help me to kind of get quite far with a lot of kind of just how I was developing my understanding around things. And I would say that, that's how it started. And for me, it was then like the neurodivergence part was then what came in like later on. So I was looking at things very much from the trauma lens. And actually, I would say that this was kind of like, say even a couple of years back, a lot of the trainings and I guess experts that I learned, around trauma, like not only in Australia, but just like even around the world, there's not a lot of acknowledgement or even like recognizing the intersection of neurodivergence and trauma, which, now in my practice, I see a lot of that happening, co-occurring. And so that's kind of the gap that I'm sensing, that, like it almost feels like in the trauma space, there's some kind of acknowledgement now, but it's still not kind of looking at how it actually coexists. And then in the neurodivergent space, I think especially in child work, like there's a lot of focus on like, meeting the neurodivergent needs. And I think that that's really cool to do that, because like in childhood, like you don't really think about trauma, until it's kind of like a post-traumatic stress, right? But there's also a gap, I think, in kind of understanding that. So I kind of feel like I'm in that sort of in that space of like in the intersection of that.
Yeah.
Yeah.
Yeah, it's really interesting, because I think like when I think of my practice, I mean, it's like evolved so much. And because I started out as a peer worker, and then I was clinically trained, and then I went out to private practice, and then I started working with a lot of autistic ADHDers. And then like there definitely was a point where I was just like like I definitely was trauma informed, but there was a point where I was like, okay, like I really need to upskill in trauma modalities, essentially, because I felt that if I didn't have those skills and I couldn't support people, or even identify and assess that, I couldn't really holistically meet the needs of my clients. And the thing is often, my clients will come to me and they won't be like, hi, I'm autistic ADHD and I have like CPTSD, like, or, I've experienced trauma. Often people like I almost have to sit there and help them to understand that what they experienced, was really distressing and, traumatic for them, and had a really big impact on how they felt about themselves and understood themselves and all this kind of thing. So I think, like you need to be able to see beyond, the surface, and I guess see those patterns. And I even think, like, you're mentioning about talking with children, and when I worked with families, I could work with the child, but I'd also work with the parents in the family. And I guess I would support the family to understand that we were at this really pinnacle moment working with the child and with them, where we could change this trajectory for this
Yes.
child and for this family. And there could be a lot of healing for them as well.
Yeah.
And I think, like a lot of parents, they could really empathize, because they were trying to healing from the grief of their trauma that they experience. And like they're like, okay, this is an opportunity to do things differently, and just being able to name that stuff, and for them to acknowledge that, and for them to go, okay, like I need to do things differently so that my child isn't going to have this same experience. So yeah, it's like, it's this really kind of magical space to work in. It can be challenging, but yeah, it's quite a very transformational space.
Yeah, and I think that, like kind of whether that's about neurodivergence or trauma, like, I guess maybe that's my neurodivergent brain, but like, having labels, not as a way to concretize things and say that it has to look this way or that way, but just labels gives us a frame to understand that there is something that we're experiencing or have gone through. So it's not this, like kind of wishy-washy thing that we can't, kind of contain. And that's kind of where in itself, like there is also the, secondary trauma of that, which, like does impact on like self-identity, which is a major marker in trauma. But like we'll get to that in a bit. But what I was going to say is that the experience, like, that you just described there, like I kind of tend to talk to, like, because people that I supervise, or like, sometimes, because I don't work with kids right now, but I do work with like, parents of kids, or like, this kind of the family system side of things. When a parent has their own, I guess, trauma experience, and, if that is still something that sort of impacts on them, that's going to also impact on the dynamic with their kids. Not to say that, like they're doing anything like wrong. A lot of times it's not, intentional, but it's gonna have like a trickle down effect. And then when you look at sort of like the child there, right? That's not trauma, because the child is having like an attachment disruption. They're having say, some difficulties in being attuned. The parents having difficulties being attuned to the child to meet their needs, because the parent doesn't know how to meet their own needs, for instance. And so, yeah, I wouldn't like, I mean, we don't want to also like say that, like just label everything as trauma, right? Like the child's going through an attachment disruption that can be supported by having the parents, have their needs met, and, do their own like kind of therapy work, and then kind of repairing the relationship to prevent like further, I guess, trajectory of like mental health difficulties, and actually developing post-traumatic stress disorder in the child. So I think that, but I guess the reason I'm saying that is because trauma is not just about, is it PTSD or CPTSD or not? It's about having that understanding and frame that's trauma informed, so that we can actually come in at different points and kind of do what sort of like what's most effective and helpful when we actually can see things from that frame.
Yeah, exactly. So I guess like intervening before these patterns solidify into like a PTSD or CPTSD. And and I guess like I've seen both ends. Like I work with folks that are kind of in their 50s, and then I've worked with children as well. So it's kind of like I'm looking at this child, but I can kind of see, like the work that we could do so that that child doesn't have to experience what, some of my, 50-year-old clients have to kind of disintegrate their whole life to make sense of it and put it back together again. So,
but I like what you said about the using labels, so it's not all wishy-washy, because I think that when we do have labels, it comes with a whole bunch of things that are already known about this thing. And that's not to say that we've got to fit everyone into boxes, because people don't just neatly fit into diagnostic categories or whatnot, but it gives you a place to start from. And, if you have a place to start from, the people that have gone before you have provided their knowledge, their understanding, their experiences to that box that has that label on it. And, you can sift through all of that stuff and take out the stuff that resonates to help you understand. And you might find when you've gone through all that actually, you know what, this isn't my label, but I found all this information which kind of points me over here. And, now I find somewhere that I feel like it fits for me. So let me move to the file in this box that's all about what I can do to help myself. What have people said that is really helpful for them? What do they do different? Whatever that might be. And again, that your answer might not necessarily already be there, but you've got a place to start. At least you're not starting all the way over in a different box that's probably really unlikely to help. So I think that, labels, I find them really, really helpful for, doing things efficiently.
Yeah, I like the way you described that around unpacking the box and sort of like, but having that as a frame and not just like fitting someone in there, because that was definitely something that either extreme's not helpful, right? There's no boxes, we don't have a frame, but if everyone has to fit nicely into each box, and then a lot of people that fall between the cracks, and I would say the more I guess minority experience you have, the more you don't fit into the boxes. So you're kind of floating around various boxes, which was my experience. And professionals are trying to go you're kind of like a little bit this, but you're not there. You're subclinical, right? That's what they call it. So for a long time I was like subclinical everything, like anxiety, depression, PTSD. And but later on, I think, because also for me, I think that I do think that there is kind of aspects where people can understand neurodivergence but miss that piece around like the trauma healing, I would say, not just identifying but also healing. And my experience was kind of the other way around, where I was kind of having some barriers to getting that full recognition in myself around the trauma experience I had, because the neurodivergent aspects wasn't identified. So it's like you can only go so far when you are not able to see things from the frame that actually fits. And so it was kind of, I think, since having my neurodivergence identified, that I could go even further with the trauma healing, and then sort of like weaving that together and then actually, coming out of it in that sense.
Yeah, that's so true. Like, I work with a lot of clients who may have already done a lot of trauma work and trauma healing work, but they didn't have the neurodivergence piece. And it's just like, once they had that, it just like opened this door to all this other stuff. It was kind of in the question mark box. I don't know. It's like, this is all the stuff that I can't make sense of, that I'm just going to put in a box and just put it over here. And every once in a while, I'll kind of get through it and be like, what the heck is this? And just put it away. So it's just like that box, the question mark box, had a label. So it's like, okay, well, I can open it now and I can start sorting it out and making sense of it. Oh my gosh, I love that. That's like, they could just go on like that forever. So, you mentioned, we're talking a little bit about healing and post-traumatic growth. So I guess like, what did that look like for you, or what does that kind of look like for your clients? Like,
Yeah, I think that kind of touches on the point that I think Tina might have mentioned earlier, around aspects of that around like self-identity. And one of the major markers of if we think about like complex trauma or childhood trauma, is that what we call fragmentation, or like a separation from one's authentic identity. And that is not something that has happened like directly. Like, it may not always be people telling you that. Sometimes it is that way, like being told like how you should be, and not being allowed to be oneself. But there are a lot of times where it's kind of just that chronic experience of not having not having that mirroring from other people, not having the safety to just be oneself and be in the full expression of oneself. And over time, just kind of developing, internalized ways to make sense of it, and going like, oh, there must be something wrong with me, like shame and guilt around oneself, not being good enough, not being lovable, all this sort of stuff. And that's kind of what I guess is a big marker of then that trauma that then persists into how it then starts to infiltrate into a person's life. And for me, that was definitely something that, again, only something I could see in retrospect, because, just being highly sensitive and being really, not realizing it then, but how much emotions are a big part of, my daily experience. And then growing up in a family system that, and I guess even the wider environment that I grew in, that were, like quite, I guess, lacking in that, like emotional space, like in terms of like emotional intelligence, and even just knowing how to kind of like, like self-regulate and stuff like that. So what happened was then it kind of developed into lots of other, coping without the actual support around that. So like that's kind of where a lot of the masking probably happened as well, right? Like, trying to push down one's feelings, then still having big feelings that come up internally, but not knowing, not having the right supports to deal with that, not knowing if there's any way that I could even deal with that, being worried about just being stuck with those feelings, and then, like, I guess finding other clever ways to kind of like work around it, right? It's like, if I think that I'm not good enough, like that was a big belief, negative belief that I had, like, much of my childhood, like whatever I do is not good enough, it always has to be better, because, like that was what I was told, and who I am naturally is not accepted. I can't be myself. It's not safe to be me. So I always have to try hard to be what society tells me to be, what, my family tells me to be. And so there's a lot of energy and effort that went into that. But then it kind of became this like, recurring loop as well, because it's like, no matter what I did, it was still never good enough. So, that's kind of where like perfectionism and burnout, and that was kind of like the forefront, right? So I think maybe that's kind of where anxiety was kind of, the more obvious part. But what was kind of happening beneath that is, this hypervigilance of, wherever I go, I have this sense that, like someone's not going to be happy with me. Someone's going to tell me that I'm doing something wrong. And also, I guess, like probably the ADHD aspects as well. It's like, my impulsivity is going to make me do something that's going to get me into trouble. And, and then like people are going to get upset at me. And like, that's going to be really scary as well, because, it's like rejection sensitivity, right? Like it really sucks when someone's upset at me because I feel really bad. And it's, but I don't know how to deal with it. So it becomes a whole cycle. And then I guess that's the aspects that then kind of translated into adulthood is that when we kind of leave those environments, then you develop like new relationships, right? Romantic relationships, friendships. Then kind of noticing those patterns still occurring, and that's kind of stuff that I've then carried from my past, because like being hyper vigilant about say someone that I haven't met before, or a new friend, and just kind of trying to, I guess, package myself in a way that would be most palatable to other people, was the only way I knew how to, be accepted. But then that also prevented me from being able to connect deeply with other people, because there wasn't the chance to be vulnerable in a way that was authentic. And so that's kind of, I guess, the kind of, background around it. I do see a lot of that in my clients as well. Like, not exactly the same, but like various aspects of those themes where a lot of people, might come into therapy, like, more often than not, they've got like an issue that they feel like quite stuck with, right? Like, constantly feeling like they've got their heart racing all the time when they're in social settings, or like performance anxiety, constantly feeling like they can't like get through things. And and there's so many aspects we can kind of look at. Like the neurodivergence is one thing, but there's also like those beliefs that they have about themselves. So like I mentioned about one of the ones that I had, the being not good enough, right? Like that's something I do see in my clients. But like another example would be like, again, the thing around like self-worth. So having clients that believe that they are not valued by other people or by society, and so like it's almost like my existence is not okay unless I fulfill XYZ, and usually the XYZ is things to do with like fitting into social norms, or even like the idea about what like achievement or success or just even being acceptable is. and then not knowing why they experience what they experience or why they are the way they are, then kind of like, kind of gets internalized into, okay, so that there must be something wrong with me, and then I have to fix it, which is kind of like what they do, right? They come to therapy and go like, you're coming to fix me and tell me that, I can get all these XYZ done so I can then be worthy. But that's not really kind of the full story, right? Because, it's kind of like, but why? Like, where did that start? Like, when did you first believe that you're not worthy as you are? Like, and I think that angle of things like is kind of what I've drawn from, like, I guess, learning about trauma and trauma-informed therapy, and also, I guess, like my own experience in kind of just teasing those things out, to get people to kind of look a bit deeper.
Yeah, I can definitely resonate with that. And I think, once I did, yeah, I don't know, I think like my trauma healing journey and my neurodivergence, like understanding about that, it's been this quite intertwined sort of thing. And it's like the more I understood about my neurodivergence, the more I was able to tease out like what is just like my neurotype and what is actually an expression of unhealed trauma. So like, for example, for me, like I am a very introverted person, like, and that's just me. Like, I really quite enjoy my company. Like, I'm super sensory sensitive. So like, even sometimes, like, as much as I love my wife, sometimes just her nervous system being in the same room as me, like it's too overwhelming for me. And like, I completely love her. And yeah, she's like an ADHDR, and she does like to verbally stim and stuff. But even so, like, even when she's quiet, like sometimes like I just need that kind of space to think. But part of me was kind of worried of like, oh my gosh, like, is this a trauma thing? Like, do I just like, like, is it that this is a need, like this is a neurodivergent need where like I just need to be in my own space and recoup and hyper focus on my special interests, like probably a lot more than what a lot of other people may. Or like, am I avoiding it? Like, am I like avoiding social contact and interactions and all this sort of thing? And I think, so I guess like being me, I have to kind of do a little bit of a self-experiment and go, okay, well, there was a time I'm like, okay, well, I'm going to intentionally try and expand my social circle and see how that grows. And yeah, there was definitely some trauma stuff there that I had to work through. And I'm glad I did, because I've got a lot more awesome friendship connections now. But still, that thing about me where I just need a lot of time and space to be in my own company, that still prevailed. Like that hasn't changed. And for me, that's really grounding and nourishing. Whereas for other people, they might look at me and go, oh my gosh, like Caitlin spends so much time by herself. She must be super lonely. And I'm like, no, I'm loving it. Like, I'm absolutely loving it just as much as I love connecting with my friends, in a way that like meets, my neurodivergent needs as well.
I find it, it's really interesting how like those social norms and expectations are applied without, even realizing it. You think about working with someone who, has a diagnosis of depression, and it's like, oh, the standard sort of generic advice, like, and I can hear my grandmother saying it, you need to get out and spend more time with your for me, that I would need the absolute opposite. My dad, he's about to go and spend a few days in hospital because he's doing a cancer treatment trial. And my sister had said, oh yeah, yep, I'll be in there every day. And yeah, he said to me, he goes, I don't know if that's necessary. And I said, Dad, when I've spent time in hospital, it's absolutely my preference that nobody comes to visit me, because if I'm there with good internet and my computer, I'm absolutely in my element. What do you want? And he's like, yeah, that's what I want. and I think that, yeah, it's that that spending time alone, and like you said, Caitlin, just sometimes even having other nervous systems in the house. Having 3 kids, they might all be in their bedrooms, all self-isolating because they're needing time alone. But that buzz of energy, for me, it's just like, yes, I am alone. I am being by myself, but I'm not completely alone. And I that sometimes.
Yeah, I can feel it, right? Like, it's not the same.
Yeah, it's very different. Very different.
Yeah. I think even like speaking to that, if I just kind of like write on that and like, bring an example of, I think the intricacy around, where neurodivergence and trauma can intersect is that, like again, what I found helpful to think about when I mention trauma is that it's not just about what happened to someone, it is what happens inside of that person when the experience is happening. Right. And so, the internal experience then is where there is that, either like a shock kind of stress, right? So like, when people think about the typical like car accident, it's sort of that sympathetic arousal, like kind of like, going like shooting up, but then not being prepared for it, and again, you think about like autistic people and kind of like not being prepared for things, it's kind of an extra layer to it. But also like that chronic kind of like stress when, like someone is in an environment where they're not able to like regulate or bring their nervous system to a more relaxed, calm state. And that in itself, that experience can breed so much of that, I guess feelings of not being safe, but also feelings of like not trusting oneself. And so if we kind of use those examples right around the need to have your own kind of like cocoon to regulate, like I can totally relate to that. And it was also something that I only had to discover in my adult life, I would say even like only in the recent like, year or so. Because just, having experience, I'll say that like, like for me, growing up, that there was kind of the concept of like boundaries was not something that was even like known about. So, like having my physical, emotional, mental boundaries being crossed like all the time and thinking that that's just how life is, and that chronic stress of having that. But then not knowing that there's kind of the alternative to it because there's the insistence, right? Like this is how, you're meant to be. So assuming like, say if, autistic person is in a hospital and once like, kind of your example, Tina, right? Like you need to have that space to regulate and actually recover. If people are going like, oh no, that's not how things work, everyone likes to have like, people around because they feel better and like still insist that, like people come visit you and bring you like lots of flowers and gifts and everything. Like the people that, I guess who see it from that perspective and like that will be like, oh, look, we're treating Tina so nicely and like she's going to feel better. But like inside, it's kind of going to be like constant, like hypervigilance and just not feeling safe, right? And I mean, and not to say like, you're definitely going to develop like PTSD from that, but we're just using that as like kind of like, example that, if that's a sliver of it and if that happens, in a day-to-day life, then you can imagine how unsafe a person would feel. And again, if not knowing the frame of why they feel the way they feel, it's then gonna, some way or another it's gonna get internalized as, yeah, like there's something wrong with me. It's not okay to have these feelings, and it's not okay to even have my needs in that sense. Yeah.
Yeah. And I think like, I guess like from my experience, like there's a big difference between, like, as you said, I have my cocoon because, I enjoy that. It's really regulating for me versus I am isolating myself because I am afraid of rejection or I'm not really trusting of other people or whatever. Like, like as you said, the why is kind of the defining thing. And, although, like maintaining that safety is really important, sometimes in order to have, I guess, joy in our lives, I guess in my experience, going a little bit out of my comfort zone and being able to cultivate those connections, like I was able to have safety and joy. Like it's,
Yes, I totally hear what you're saying there, Caitlin, because this is kind of where again I love my concepts there where just draw from different things, but you think about like, okay, oh, well, this is something I would like to draw out, but like if you I'm just gonna use my hands for now. So if you have 3 layers of like the bubbles, right? You have like the first layer which is safe and comfortable. So that's the place that like when we come to like rest and kind of like down-regulate and like, okay, this is fine. The cocoon, right? I mean, for some people, the safe and comfortable may not be a cocoon, maybe like lots of people in there. And then the next layer would be safe but uncomfortable. And then you have a third layer that is unsafe and uncomfortable. So when you have like that safe and uncomfortable, I think that's what you're referring to. Like, when we have choice in like, okay, like I think I need to kind of, join some community or do some stuff outside of my home. And it's uncomfortable because it's new and it's not something I've done before and, and all the other kind of reasons. But because I'm choosing to do that, and maybe I might put some accommodations in as well, go with a friend, or allow myself to leave if I don't feel up for it. That's safe and uncomfortable. But if it's like, oh, it's not okay to like, not like to hang out with people all the time, so I gotta like, do it, and like that's the only way like you can human. And that sort of like, self-criticism, self-rejection, and like, being in an unsafe, perpetual unsafe state, and then also feeling uncomfortable, like that's kind of what puts a person more at risk of like developing the trauma. And then what I mentioned about like being fragmented from one's like authentic identity and that sort of safety within oneself. Yeah.
Yeah, yeah. Because I guess we like sometimes the missing piece, I mean, for myself and for my clients, is that often we will replicate the dynamics within us that we experienced, in maybe some of our relationships outside of us. And I guess, looping into the healing and the post-traumatic growth, I think, like a lot of my journey was externalizing and trying to understand, some of these outward dynamics and, my part to play in those things. But I guess like the real healing came from going within and seeing how I played out those dynamics within myself.
Yeah.
Kind of like, like, as you said, like, self-rejection or self-abandonment or, self-deprecation and all these sorts of things. Like, because at the end of the day, like, you can't escape yourself. Well, I mean, psyches are interesting and they can do fun and wacky
We
things.
can, but saying, right, how long that will last is important.
But like, we're in this body, in this container.
Yeah.
So if we're constantly beating ourselves up and not treating ourselves with kindness, it's going to be quite hard to show up in the world and, with kindness and, feeling good about ourselves or anything like that. So, yeah. So I guess like, when it's your healing journey look like, or for your clients, I guess, what does that look like, particularly for neurodivergent people?
Yeah. I mean, I think that, it's so multi-layered and, there's so many aspects to kind of peel off the layers of the onion. But I would say that, so for myself, it did start off with, like kind of working through those, I guess what you call like the mental health symptoms first, right? What's kind of, I guess the coping, like say perfectionism and, that hypervigilance around like people and stuff like that. And just sort of unpacking that, but then going into the next layers, I guess for me, because just maybe that natural inclination to always want to like understand why was also what helped me to then, I guess dig deeper into my own psyche and not just kind of like take things as surface value. So, and maybe also fortunately, just kind of as I was doing my own training in like trauma processing modalities, I was also getting trauma therapy in those avenues. So like EMDR, which is eye movement desensitization and reprocessing, and internal family systems, which is more like kind of working with parts of ourselves, that multiplicity, but that relationship with like the self and all parts of ourselves. And I found that what was helpful for me was not just to kind of go with that thinking, cognitive way of like, this is how things should be, because that was already something that was drilled into me and, it didn't work very well. So like kind of just talking about things like in therapy was not really kind of doing the job. And so when I kind of started to discover ways to go beyond that, right? Looking at the emotional layer, looking at the body as well, like so somatic experiences, like because one of the famous books, like in kind of, I guess, bringing trauma and like PTSD to like kind of the general public was Bessel van der Kolk's book on The Body Keeps the Score. And there's a lot in there that talks about not just about that title, but I think that in itself has been like quoted a lot. But just kind of the idea that like trauma is not just kind of like what we think or how we remember things. Like that's one part of it, but there's also like how our bodies remember things. So a lot of it was quite unconscious as well. Like if something that was traumatic before, like kind of happens again in my present day environment, but it's not actually threatening to me, but my body feels like it's in threat mode, and then that sort of incongruence, right? That mismatch of like, this is supposed to be okay, but like I'm feeling not okay. So that's kind of like the access point that I found helpful, like just kind of going beyond, just kind of like making sense of things. I think it's like having like a brain that likes to kind of, finds comfort in like playing around with things, in that sort of mental puzzle. It's a double-edged sword, right? Like it helps you to kind of like figure things out, but it can also like distract and take away from the actual like, what's kind of at the core and beneath that. So I found that when I did a lot of like my own in my own therapy, actually going through those processes, like so in EMDR, without I guess going into the intricate details, it's you might kind of like be working on specific memories, but what you're also kind of targeting is that like what we call the negative core beliefs, like, so the stuff I mentioned about like, like about self-worth or about, lovability, or like I'm a bad person, or that all that sort of stuff, right? I'm not safe. It's not safe to be me. So those aspects that then, activate those physical somatic sensations in a person would be then the access to shift that. And in that process, then free up this space of, what has been carried in the person to then be freed up, so that you can bring in like, the more positive stuff that actually are more aligned with the person's values, right? So instead of like, I'm not good enough, it's like, I'm okay as I am, and, it's okay to be me, and I'm worthy as a person. Yeah, like that sort of stuff, which I often find that like, it's kind of both in my experience, and I guess I probably also have clients who I do think that as therapists we tend to more or less attract clients that are a bit more like, bit more similar to us, and have experiences that, like, I guess, yeah, that's kind of that what do you call that, yeah, just being more aligned, right, in the way kind of that you think and work. And so not all the time, like I do have clients who do come in with like the, tell me how, problem solve, and but when I find like there is that sort of avenue to kind of, not just convince them, but show them that there are possibilities to kind of, do things a bit differently, and they actually experience that and then feel like, see the positive results of that. Like I have my clients, my longer term clients who I've worked for more than a year or so, like it's almost like they actually look forward to like the sessions that we get to do that deeper processing. So I'll be like, oh, how about, what about, let's just go inside and like, get to know these parts of you and then see what's happening, like what's your body showing. And they'll be like, okay, yep. And they'll like close their eyes and just like be ready to like go there. And I often like, I really enjoy those sessions because I'm like, yes, I don't need to like, convince a person. I can just kind of do the thing that I like doing as well. And I don't think, I mean, I want to caveat that by saying I don't think like all trauma therapy has to look the way like I do it, but I do, just based on like evidence, based on my experience and what I see in my clients, like, that more often than not, having that sort of multi-axial kind of like way of like targeting is what really helps to create like more lasting change, which kind of is the aspect that I really am, I feel strongly about in like advocating that, a lot of times people don't know that that's like what we mean when we say like, healing from trauma, right? People think that trauma healing is going into a therapy session and talking and talking and talking, and then people think that they have to talk at a therapist about all the bad things that happened to them. And it's like, oh yeah, okay, there's a space for that a little bit, like, like being witnessed by someone, if no one's heard your story before, and like being witnessed can be really validating, but that's not all of it, because if that's what it is, like that's why people feel like worse after therapy, because they go in and they pour everything out and then they leave and they go like, why do I still feel shit? But that's because like you sweep all the dust like, from the ground, and you're going like, okay, yep, session's done. And it's like, of course you're not going to feel good about yourself, so I often like kind of like, look at those perspectives where yeah, like I don't even get clients to like just talk about, their trauma. Of course, like, I get consent if they want to, and they need that space for that, like, we set that up. But even in initial sessions as well, it's very much just, like, okay, like, just need to know the ballpark of it. But if we're going to actually process it, then we'll get into it. And that's when it's really helpful, and we actually can contain that and actually do some stuff around it that you can actually leave like, not always like feeling great, but at least there's some shift within oneself. And that in itself is more healing. Of course, the healing journey kind of like, carries on from Like, it's not just that, but that's really kind of like what I think is so pertinent, and the difference between like that, I guess what we call pure talk therapy and like trauma therapy. Yeah.
Yeah. Yeah, it's so funny the comment that you made about we tend to attract clients like similar to us. And I'm a PDA and I work with a lot of PDAs and they're like, I would like your support, but don't tell me what to do. And I'm like,
Yes.
totally respect that. Like I 100% eh, 100% respect that. And I agree. I think a lot of people do think that, and as you said, talk therapy can be really helpful, and sometimes that can be part of like getting that box out, having a look, trying to understand, I guess, on that intellectual cognitive level, try and do a little like pre-sorting, so to speak. But I'm not EMDR trained, but I use something called the flash technique, and yeah, like I say to my clients, we do not have to talk about the trauma or the incident at all. We can go into the body. We can explore that somatically and process that. And the thing I love about it is that part of the process we talk about a positive, engaging focus. So a lot of my clients, they get to talk about their special interest while we're actually processing like often really challenging traumatic experiences or events that have occurred to them. And then after we do that processing, they have a lot more clarity and they have a lot more compassion and curiosity for themselves in that experience. So it's kind of like um, when you have this trauma that's in your body that is so vulnerable and delicate and raw, until that can kind of move through your system, you're not going to really have true clarity because it's just kind of cloudy and confusing and painful and all these sorts of things. And I think it can be, it takes a lot of bravery and courage to go through that process as well. But I think like like you said, Vera, like sometimes there can just be such a shift for someone just in like one session where this thing that they've carried for so long, they're like, what the heck? Like this is something that I've really struggled with for like years and years and years. And now boom, like my worldview and the way I feel about this thing is just completely changed. So I just, yeah, it's magic, basically. I think it's like the closest thing to magic, really. Yeah.
Yeah, it does look like magic.
I think as well with that, working with people that are similar to ourselves as therapists, I think it really highlights the value of lived experience. I think that yeah, when we do attract clients that are similar to ourselves, that lived experience becomes such a valuable part of that therapeutic process, because there is just something so special about working with someone, and I'm speaking now from a client perspective, someone who has in therapy myself. There's just something so special about talking to someone about those things you're experiencing before you get to the point of being able to clearly define it, explain it, whatever. You're just muddling through with all these words, and that other person can kind of reflect back to you something that makes you go, yes. And, that sense that this person, they get it, they get it on another level. And yeah, so I think that there's something really special about that. And I think it's not coincidental that we, attract people that are similar to ourselves, I think.
I agree with that. And I think that that's something that, probably I would say maybe even in like the psychology space, not sure about social work, because I think there's there's some angles I think in social work that, that psychology can also like learn from. But this, aspect of like, having a sense of relatability, community, that relational aspect, right? That sort of even sense of like belonging to a community. Sometimes the community, if you don't have access to it, it might be that one person, which might be your therapist, right? And I guess is parallel processing actually a thing that, or did I coin that, or did like I don't know where that came from, but it's like is that a thing that people use? Like, but I call it that, right? Like parallel processing. It is, like I realized that I it's only since knowing about my neurodivergence that I found it so much easier to self-disclose intentionally in sessions and share about aspects of myself that, can then help the client to actually understand themselves better. And again, like with PDA, right? Like I probably have quite a number of clients who are also PDA because I am, without initially not knowing. But it's really helpful to, like, if it's really hard to talk about something directly, just being asked a question and expecting, like, person to tell you, like, okay, like, this is kind of like what my experience is, like, that sometimes there can be the internal resistance, whether that's from a a nervous system way or just kind of like more of a trauma response, right? And just being able to go like, oh, wait, like, let's just kind of think about it this way, like, what if I just share something that I that's coming up for me when when you mention this, and maybe when you hear my experience, that might give you some idea about like what might be going on for you. And a lot of my neurodivergent clients really like that. And it's almost like when I'm just starting to talk about me, and then I can see on their faces they're really thinking about themselves, right? And then like from not having anything to say to, like, kind of getting more like interested, and then like going like, oh yeah, like this and that, like I relate. Or even like sometimes it's not about relating, it's about like, oh, like you mentioned this, but actually I experienced it this way. That's still helpful to have context and understand. And so I think that like this aspect of having that parallel processing or the mirroring, and just having someone who you can kind of go like, oh, I'm not alone in it, but also like the way they think, the way they kind of navigate the world, I can kind of see parts of myself in that. And so maybe there's actually like something here that actually is valid, and I can kind of label it and make sense of it in that sense. And that's so much value. I think that's also part of the healing journey, if anything. But if I kind of just draw back to what you were saying, Caitlin, about that like I use the flash technique as well, among other aspects in EMDR. And like that's where kind of like when someone's carried stuff like for so long, and it literally like clouds one's judgment, you can try really hard to try to convince them about, no, this is how you could do life differently, this is how you could relate differently. But it's just going to feel so effortful, and perhaps even like be the person might feel like they're failing at it, because if you're constantly having like things weighing down on you like a straitjacket, and you're trying to like move through life, it's just really hard. So when we can just kind of have aspects of healing that just helps the person to lift some of those weight up, then it's gonna then free up some space to go like like kind of like some of the dark clouds are gone. I can see peaks of the the sunlight coming through, and then going like, oh, actually maybe it's possible to kind of like do things differently or see things differently. And that's where there's probably more access to then I guess that's where we can kind of bring our own examples in, and have that like more, I guess, like maybe typical talk therapy kind of stuff that would be a bit easier to kind of like work through. I will also say that this is a little bit of a side point, but what I found interesting in my work is that a lot of my clients like tend to come to me for like trauma work, because like that was kind of how I used to advertise my work. Now I've included neurodivergence as well, but back then, like I had a lot of clients who came in for trauma, not knowing that they were ADHD and or autistic, and it's almost like when I'm doing processing with them and just kind of tracking how they think, or the way that they engage with like things, is actually what made me think about, oh, this person might be autistic or ADHD or both, and that's the part that I think maybe it's from like clinical experience, but I think also from my own lived experience, where I could then kind of draw on that to go like, it's not just how the person behaves, right? Like, I mean, if you talk about the DSM, that's kind of, they have to behave this way and that way, but like it's almost like when I actually see how the person thinks, like say in EMDR, there's like, how detailed someone goes into like, how they it's hard to put into words, but just kind of elements of like the quality of how someone thinks and engages with the world, the internal world, basically. Like doing trauma work, I think allows me to kind of join. It's such a privilege to be able to join a person in their internal world and then get a sense of that and then feed that back to them, where like more often than not, like it's not something that we don't just show people like those aspects of our internal parts, right, as easily. But that's kind of where then the identification would come about. So sometimes that's a place where I would go like, actually, do you know, like maybe you might be autistic, maybe you should explore that. Yeah, which is really yeah, I do like being able to kind of get to those places when people are, I guess, open enough as well to explore that.
Yeah, you're so right. It is an absolute privilege. Like it's such a privilege that people, trust us with their story, and yeah, and especially when, when often a lot of neurodivergent folks, they've been through a lot, particularly interpersonally. So yeah, 100%. I'm just looking at the time because Tina's got another meeting. A busy person. So I just want to wrap up. It'd be really good, if you had any thoughts about, how professionals could, like understand a little bit about like that intersection of trauma and neurodivergence. Like, is there a way that they could, be able to tell the difference or kind of see when things are co-occurring?
Yeah. I would say that this is definitely something that has to be more like system-wide kind of like shift as well, that health professionals in general get upskilled in. Not everyone needs to be trained in doing like trauma healing modalities, because that's quite like as niche in itself, but just being able to identify and pick that up and actually refer to someone who can then do the work with them. I think that's really important. But the initial identification, I think one thing I will mention that's going to be, I guess, helpful is, I think the first step is to actually recognize, like that trauma is not just something that is like you know, yeah, that sort of one-off, dangerous situation that someone goes through, especially in the neurodivergent space. A lot of it is that chronic, experience of being misattuned, not having one's needs met, constantly being in stress, chronic stress, and sort of how that impacts on the person, and whether they develop like, PTSD or not, like that's, I guess that there's other aspects of that. But just for people to be able to have the lens to go like, let's not just, ignore that or just go like, oh, that whole idea of like, it's not that bad, right? It's kind of a bit of a similar frame with like identifying ADHD and autism as well. If someone's kind of having some concern and they're saying like, I'm struggling with this and that, rather than going like, they seem to be functioning fine, so it can't be, and just telling them that's not. I think with trauma, it's very similar as well. It's like, just because it's not obvious, to you, like it doesn't mean that there isn't. So to kind of be a bit more kind of curious, about what might be going on for the person. And I think, yeah, like, if there is, I guess, even a little bit of interest, like, yeah, there's lots of information out there now, like, whether that's like podcasts or books or, even like, I think like, yeah, like training platforms as well. There's lots online. I think back then, before I was able to like pay for the, I guess, more expensive in-person trainings, like I did a lot of the online ones that are very much affordable. That just helped me to kind of expand my understanding around trauma. Like those are some great avenues to start to just kind of have that understanding. And one kind of maybe final thing I'll mention is that because I guess I could go into the oh, here are the questionnaires, here are the things, and that, like, what to do. Like we can stay very kind of like quantitative around it. I think there's value in that, but like there's space for that. But I don't want to focus on that here. I think the other aspect to kind of think about is, again, like the self, right? Like kind of akin to my journey. It's only when I really kind of deep dive into my experience and truly try to understand myself that I could actually then have perspective for what's going on for my clients and other people. And the reason why I say that is because, like, not everyone has PTSD or CPTSD, but no one is like will go through life unscathed from some level of like stress or like some like big challenge in life, even though they might not think it's big, because there's also this concept of intergenerational trauma, right? Like, we have, a lot of us have had, parents or grandparents who've been through like lots of huge stuff that, and there's evidence as well, like genetically, environmentally, like, things get passed down. So like our generation and the generation after still having, residual impacts of that, which might look like anxiety or depression or all the other mental health stuff, right? Or chronic health conditions. But we just have to really, like be open to the fact that things don't always need to look like one particular way, and just stay curious. And that will open more avenues to like healing and, avenues to understanding oneself, and then actually being on that journey of growth.
Yeah. 100%. I would say that personal healing is like professional development, particularly if you're being supported in the same therapeutic modalities you're using. Yeah, I don't know. Is therapy tax deductible? Maybe it should be.
Yeah.
Yeah.
Yeah, I really love that.
Mm-hmm.
Maybe there's a case for it.
Yeah.
I would say it is. Yeah, I would say too. Yeah, thank you so much, Vera. This has been such an amazing
Thank you too.
conversation, and I think a lot of people will really value it. And also, just for our listeners, I just wanted to let you know that yeah, this is the last episode for the year. So yeah, Tina and I are taking a little bit of a break. And then yeah, we'll kind of reassess things next year. But yeah, thank you so much, Vera. This has been a really lovely conversation. Yeah.
Yes, it was fun. Thank you.
Thank you for having me.